Okay, we're here with Dr. Bidkaram. Dr. Bidkaram, can you tell us more about shockwave therapy?
So extracorporeal shockwave therapy, actually, it's been a technology that's been around for about 40, 50 years. It's, for lack of a better term, it's ultrasound on steroids. You have pure sound pulses that are directed to a certain depth for treatment of different conditions. Things like tennis elbow, plantar fasciitis, trochanteric bursitis, different musculoskeletal conditions.
And what's the physics behind it? How does it achieve, what does it do mechanically to the body to achieve its pain relief?
So, as you know, most of the musculoskeletal conditions, there's some common denominators as far as problems with them. One is the scar tissue that forms. When you get injured, your body, the first thing that it does, it creates scar tissue, it creates inflammation. If it's in the spine region, it creates muscle spasming. Unfortunately, that stays on for years after year, and a lot of times nothing has been done properly to break up that scar tissue. And scar tissue, one of the main problems with it, besides having a real bad matrix, being less vascular, it has more pain receptors than normal tissue. So the areas that we injure, for example, shoulder, elbow, feet, low back, what have you, they develop what we call trigger points. These are the areas that have higher scar tissue, and the higher scar tissue has more pain receptors. So we always have not only weakness in that area, but problems with them. They reoccur all the time because that scar tissue has not been addressed properly or broken up. So extracorporeal shockwave therapy, we're able to go in there, determine, let's say for example, if it's a tennis elbow where you injure that joint, what the machine has given us, or the technology has given us the ability to do, is to go in there, figure out how deep we need to go to access where the tendon attaches to the bone. And via the sound pulses that the machine generates, we could break up the scar tissue that forms in that area. So there's several things that happens. Not only we're breaking up the scar tissue, so we're eliminating that, the more of the pain receptors, what's referred to as nociception. We're also getting rid of the chronic inflammation that that exists there. We're also modulating or getting rid of or reducing the substance B production, which leads to pain formation, and restoring or creating more vascularity to the area, which leads to faster healing.
Right, and scar tissue is different from regular ligament tissue in
Correct.
that it's less elastic, it's my
Correct.
understanding. So this is why you re-injure the same areas. It's a stress point, and it's going to give.
Correct.
Typically. So basically the shock wave kind of breaks down that abnormal matrix,
It does.
and then does new tissue grow in there, or?
Yeah, your body has anytime that you have an injury, first of all, normal tissue, it's more linear in pattern. Scar tissue, it's like a blob. Think about a hairball, because your brain is trying to heal that area as quickly as possible. So it infuses the injured area with a lot of that scar tissue, and also it doesn't get enough time to have enough vascularity go into that area. So it's weaker, and that's why we always have problems existing if it's not taken care of properly. So what I do, I utilize the shockwave therapy to break up that chronic scar tissue formation, and via specific chiropractic adjusting, realign that area, whether it be in a extremity joint or spine, and allow your brain to lay down new scar tissue that emulates normal tissue as much as possible, more linear in fashion and stronger.
I see. So that's where the rehab comes in.
Correct.
Okay, good.
Okay.
And does it hurt?
It is uncomfortable a little bit, but the patient's tolerance is what we always ask them to do, to tell us how much they could handle as far as the intensity that we use, because you could change the frequency, the intensity, the depth of penetration by changing the headpieces, but also the number of pulses. So if somebody could maybe handle a 1 or 2, that's all we do. If somebody could handle a little bit higher intensity, that's also what we do. But as the treatment begins and commences, because we're breaking up the scar tissue, the patient's tolerance also goes up, because now they don't have as much pain receptors that we have to deal with. So they could handle more of an intensity as far as the pulses are concerned.
Makes sense.
Yeah.
And I guess the longer an injury has been chronic, there's probably more scar tissue, so you would
Absolutely.
probably want to go with a higher intensity, right?
Initially, no. We want to make sure, because the way the protocol that I developed is I determine how deep I need to go to get to the, basically what we call the periosteum, which is the sheath that covers the bone. And I work backwards. So let's say it's the maximum depth we need to get is 25 millimeters. These headpieces are in 5 millimeter increments. I start at about 15, I do 2 at 15, 2 at 20, and then the last 3 are done at 25 millimeters. Sometimes the patient needs more than 7 treatments, maybe up to 10. So we kind of manage that, but as we start shallow, we slowly start building up on not only breaking up different layers of scar tissue, but also the intensity of the treatment goes up, but the patient doesn't perceive it as much.
Well, that's awesome, because my understanding is that there aren't many modalities that can go 25 millimeters.
Well, with this one, we could actually go to 30 millimeters.
Yeah. So a lot of people don't know, when you put a hot pack on your skin, it's pretty much superficial.
Sure.
It doesn't get down to, like, let's say you have a deep joint like a hip.
Mm-hmm.
The acetabulum is,
Correct.
How many millimeters is that? So.
Well, depending on the patient also, I mean, this technology has been used by veterinarians for a long time, and they have access to applicators that go as deep as 40, maybe 50 millimeters.
Wow.
To treat horses and what have you.
Mm-hmm. Yeah. Great. And where would one go? Is this something that's common in the United States?
So it's actually extremely common in Europe and Asia. They've been utilizing it for a long time. All the pro sports teams, especially soccer teams in Europe, they use it. That's as a normal protocol. I worked with San Jose Earthquakes here locally. Some of their players were European, and after they had been injured, they requested European protocol for their rehab. And they had provided all the rehab things, but there was one thing that was missing, was the shockwave therapy. That it's a normal process for rehab protocol that they have. Teams like Barcelona, Real Madrid, and all of them. And the strength and conditioning coach is one of my patients and a friend of mine, and he had referred the patients over to add this to their rehab protocol. But as far as in the United States, it started in back east and basically making its way into western United States, West Coast, Southern California beginning, and my colleague and I were the first ones to kind of bring it up to Northern California about 10 years ago, and we've been doing it longer than that.
Mm-hmm. And just so you give a good analogy of this, did you say it's related to the machines that got rid of kidney stones? It's
Yeah.
the same kind of technology, basically?
It is the same technology. Lithotripsy is a class 2 modalities that it could only be used by medical doctors, urologists, to break up kidney stones. This is a FDA-approved class 1 modality in the same category as ultrasound, TENS unit, muscle stem, Russian stem, all of those.
I see.
So it is within our scope of practice as chiropractors to be using it. Also, the technology, this particular unit, and with the headpieces, can also be used in the shockwave therapy for conditions like erectile dysfunction, for non-union fractures, which those two conditions are out of our scope. So if we want to be able to work with those patients, we have to work with medical doctors under medical supervision and with their medical licensing.
I see. How about someone who's post-surgery?
Yes.
Would that be, and how long after the surgery? Like, let's say you had knee surgery and you want to prevent that scar tissue from building up. How
Well, as you know, with the knee replacements, they get them on movement and rehabbing immediately. One thing that we have to, it's contraindicated with this unit. Again, going back to how they found out about it, because we can't be utilizing it right at the replaced parts. Basically, because of the sound waves, it jars the knee replaced areas or shoulders or what have you loose. So we have to avoid anything that's artificial as far as metal or plastics within that area. But utilization of it, I've done pre-surgical, post-surgical, as soon as possible, because you want to get maximum amount of improvement in as soon as possible prior to scar tissue forming. So
great.
Yeah.
Could you maybe explain some of the cases you've had that
Sure.
have been successful?
As far as when you're looking at the RCTs, as far as the randomized controlled trial studies that you look at across the board with Shockwave and the technology, they show about 70 to 80% very positive results with conditions that it's used for. In my clinic and also my colleagues' clinic, I could easily tell you it's been above 90%.
Wow.
Things like carpal tunnel syndrome, which is very common, as you know, but some of the conditions that I've used this quite a bit are plantar fasciitis, tennis elbow, calcific tendonitis, calcifications in the shoulder. It literally breaks up calcium
Frozen
deposits Frozen shoulders takes a little while. I used to do manipulation under anesthesia, which was a little bit faster, depending on how chronic that is, but it takes more treatments for a frozen shoulder, and it has to be really combined with proper rehabbing as far as getting in there with the exercising. But again, plantar fasciitis, calcification, which is one of the big things, tennis elbow, golfer's elbow, jumper's knee, trochanteric bursitis, a lot of different cases.
How about TMJ?
TMJ you can, especially if you have inflammation, but you have to use a very shallow and very minimal amount of pulses and intensity just to be basically to work the temporomandibular joint area. But deep retains contractures where patient's fingers are stuck, you could use it for that. Anything that you're dealing with fibrosis, adhesions, or scar tissue formation, which almost is everything in musculoskeletals. So,
okay, it sounds like an amazing machine.
it is.
I think if you have any kind of chronic joint issue, especially if you've lost some flexibility in it and you've tried everything else, then Shockwave seems like it's the next logical step. Right?
It is.
If you have it available.
It is. And
Yeah.
the one thing is, most of us chiropractors that we always deal with musculoskeletal conditions, one of the things that we always face is, unfortunately, most folks come to see us as a last resort. So when they come in as a last resort when they've been injured, was one of the things that we always face. It's chronicity of the condition, scar tissue formation, muscle spasming, inflammation, all those things. And that's where this comes in to be able to address that. So now we could properly restructure the areas that have been injured.
Nice. So do we have a patient that we could
Yeah, we
try
have a
some?
patient. I have asked my assistant to join us, and she has a
Great.
little bit of a tennis elbow stuff that we're going to demonstrate the machine on.
Okay, great. Let's do that next.
Sounds great. So we have my assistant Natasha here, and she's going to help us with demonstrating how the Shockwave works. She has a tennis elbow condition that I'm going to be utilizing the Shockwave to treat as one of the treatments that we've done on her, and so far it's been pretty successful for her, and I'm going to demonstrate what we do. So just like a ultrasound, what we want is we want to use gel, ultrasonic gel, for conduction and better utilization of the sound and effectiveness. Now I have the patient just exposed with the elbow. The unit itself, I'm going to be using what we call the focused headpiece. Basically, if you want to come a little closer, I could show you how this is. As you could see, it's a concave applicator. The difference between this unit compared to other Shockwave units is that this is a piezo effect, meaning it's crystals that line the applicator itself. As the electricity comes in, the crystals, they start vibrating and actually generate a sound pulse. On this particular unit, the piezo wave 2 and the direct applicator that I'm going to be using, the sound pulse is 1 centimeter cube, so like a sugar cube type of a thing. I could change the frequency. There are 4 factors that I could change and modify. I could change the frequency, which I use in her case, a maximum frequency of 8. That gives us 3 to 5 pulses per second. The intensity could be changed, and the highest amount is 18. They're measured with millimeter square per megajoules. By changing these headpieces right here, we could actually change the depth of penetration. We could go as shallow as a 0 millimeter penetration all the way up to 30. And basically the next thing that I could change or modify is the number of pulses. In her case, for the demonstration, we're going to do about 500 pulses to see how the unit works. And basically, we have a foot paddle over here that I could control the pulses, the intensity, and so on. And I'm going to start her at about actually a 5 intensity. We apply the gel to the area. And what we want to have is make sure that we have the head applicator directly on the area that we're treating. I'm going to disperse the gel. And when we're ready, we could go ahead and, by stepping on this or utilizing the button here, we could go ahead and get the sound pulses going on. So what you're going to be hearing is, these are the sound pulses. And what we want to do is make sure that we hit all the lateral epi area where the radial head is, the proximal radial head. And we slowly move the applicator around right where the injured area is. And we always want to ask the patient, how intense is it? We always want to make sure that we go to their tolerance and not above that. So how intense is it on a 0 to 10 scale?
Maybe like a 4.
Okay, is that tolerable or should I go down?
No, that's good.
Okay, so we're going to continue with this.
And we'll look at the number of pulses. You could see the total dosage, basically.
Correct. And normally for an extraspinal area like an elbow or shoulder, I do about 3,000 pulses, depending on the patient, how large or small they are. I might modify that for a taller or bigger person that we're covering a larger area. I might be doing actually 4,000 pulses or, somewhere in that area. But we also want to make sure that we hit all the extensor tendons as well as they come into that lateral epi area. And I like to kind of cover a larger area as I go down the back of the forearm to make sure that the belly of the muscles are also affected, because this breaks up the fibrosis and adhesions within the muscle and not just the scar tissue around the joints. Are you still doing okay?
So one of the things about scar tissue is that and adhesions, let's explain that a little bit.
So adhesions and fibrosis, think about the analogy of it as like cobweb that forms within the muscle. Scar tissue, you like to use the analogy of basically rust that forms on a surface or around the joint area. And as we're utilizing this, it kind of like sandblasting a surface. It breaks up all that scar tissue. And
that's a good analogy, sandblasting.
Yeah, and by utilizing sound pulses only, and no electricity, nothing. And as we do that, especially right here, as I'm irritating that periosteum, which is the sheath covering the bone and where the tendon attaches, because we're creating micro traumas, it also causes new blood supply going in there. So as a new blood supply going in, one of the things that the shockwave does is creates neovascularization, or new blood supply formation, which leads to faster healing process and recovering from the condition.
Right.
That's why it becomes so effective. Now, the other thing that keep in mind again, this is not an ongoing treatment. The number of treatments usually is about 7 to 10 per area, and then we follow up with the patient 2 to 6 months, once a month after the last treatment to make sure that things are improving and where the patient is at. And if the patient by the 2nd or 3rd month, they tell me that they're about 90-95% better, basically they're done. But sometimes they say, well, they plateaued at about 80-85% improvement. In that case, I might decide to do 1, 2, or 3 more additional treatments, basically to get rid of whatever that residuals that are remaining.
Starting to get a bit more intense. Starting to get a bit more intense.
Is that right over here, huh? Do you want me to turn it down? Okay, so let's go down.